So you're looking to maybe get a better handle on mental health, cut through some of the diagnostic clutter.
Yeah, it could feel like a lot sometimes.
Exactly. Well, that's what we're doing today in this deep dive. We're digging into the transdiagnostic approach to mental health care based on some really interesting material. Our mission really is to understand this alternative way of thinking and what it might mean for, mental well-being.
Absolutely. It's a shift in perspective. Instead of seeing things like, say, anxiety and depression as totally separate boxes,
Right.
the transdiagnostic view tries to find the common threads, those psychological processes that run underneath a whole range of difficulties, finding the shared roots, basically.
Okay, let's unpack that. So traditionally, you'd focus on the specific symptoms of, panic disorder. How is this different?
The pivot is the focus.
Yeah.
So rather than targeting panic disorder itself, a transdiagnostic therapist might look at something like avoidance.
Avoidance. Okay.
Yeah, which you see not just in anxiety, but also potentially in depression, maybe even substance use issues. Or another big one is rumination.
Rumination, that repetitive negative thinking loop.
Exactly that. It cuts across so many conditions.
Right. So you're pinpointing these sort of fundamental mechanisms that fuel different kinds of problems. Makes sense.
Precisely.
So by hitting avoidance or rumination directly, you might see improvements in multiple areas.
That's the idea. And that's where the potential for, efficiency comes in. Tackling a core process might help with several issues someone's facing.
Is there evidence for this? Does it actually work out?
Yeah, there is. The sources we looked at mention evidence-based transdiagnostic treatments. The Unified Protocol is a key example.
The UP, right, that targets core emotional processes.
Exactly. And some studies, mentioned in our material, showed patients using the UP had significant drops in overall anxiety and depression scores, sometimes even comparing favorably to standard CBT for specific diagnoses in certain trials.
Okay, now this is where it gets really interesting for me, because let's face it, so often people are dealing with more than one thing at once. Comorbidity. How does this approach handle that?
That's often seen as a real strength because it's not strictly tied to those individual diagnostic boxes. It's arguably better set up to address that overlap. It looks at the shared underlying stuff that might be contributing to, say, both anxiety and depression, rather than treating them completely separately.
So it acknowledges the fuzziness, the way these things often blend together in real life.
Exactly. It kind of reflects that reality a bit better, perhaps.
So if we start focusing more on these core processes, what does that mean for how we even diagnose things? Could it change systems like the DSM?
That's a huge question it raises, yeah. It makes you wonder if maybe our current categories are a bit too rigid, or maybe don't capture the full picture of how interconnected these things are.
So we might move towards something more dimensional, looking at the severity of, say, rumination rather than just a yes-no diagnosis.
That's definitely a possibility being discussed. More of a spectrum approach, perhaps.
Okay, so let's make it practical. A therapist using this, they wouldn't just pull out the standard social anxiety treatment plan.
Not necessarily, no. They'd be trying to understand your specific pattern. What are your problematic processes? Is it fear of judgment? Is it avoidance of social situations? It becomes tailored to the individual's functional issues.
How does this connect with therapies we already know, like CBT or ACT?
Good question. So with cognitive behavioral therapy, CBT, which often targets thinking patterns,
Right.
a transdiagnostic lens might look at the function of those negative thoughts. Are they driving anxiety, depression, both? What job are they doing?
Okay.
Or in ACT, acceptance and commitment therapy, which focuses on psychological flexibility. The transdiagnostic angle might target, say, experiential avoidance, that tendency to push away difficult feelings as a core process across many different struggles.
So using established tools, but with this deeper layer of understanding about shared mechanisms.
Got it. Now, it sounds really promising, but are there downsides? Any pushback or limitations?
Oh, sure. It's not presented as a perfect fix for everything. Some critics worry that focusing only on what's common might mean you miss important specifics about certain conditions.
Right. Nuances could get lost.
Potentially. So there's ongoing work about how best to integrate this approach, maybe alongside traditional diagnosis, not necessarily replacing it entirely yet.
Okay. So wrapping this up, for you listening, the main takeaway seems to be that this transdiagnostic approach offers a different way to view mental health, focusing on the common sort of engines behind various challenges.
Yeah, exactly. And maybe a final thought to leave you with is this. Could understanding these core processes, things like rumination, avoidance, maybe emotional regulation, could recognizing those patterns in yourself give you a more proactive handle on your own mental well-being, regardless of any specific label you might or might not have? Interesting. Focusing on the process, not just the problem label. Lots to think about there.